Mycoplasma. Mycoplasma is the smallest bacteria in our world. Their diameter is only 0.3 millimeter. The most important criteria of the Mycoplasma is that they do not have any cell wall. As they do not have any cell wall, so that the cell wall active agent or the drug that destroy the cell wall of the bacteria like penicillin, cephalosporin, vancomycin, bacitracin, cycloserine, these drugs do not produce any effect on this bacteria. Their cell membrane is very flexible, and due to that reason they can change their shape at any time. And also their cell membrane contain cholesterol, which is unusual because we know that the prokaryotic cell membrane do not contain any cholesterol, but in case of Mycoplasma their cell membrane contain cholesterol. So these are some important criteria of the Mycoplasma. Now pathogenesis. Mycoplasma, they attack our respiratory system through the respiratory droplets or through the air. They enter our respiratory tract and they attack our respiratory epithelial cell. And this is our respiratory epithelial cell, and we know that our respiratory epithelial cell is ciliated, so they contain cilia. This is the cilia of our respiratory epithelial cell. And when this pathogen, this Mycoplasma pneumonia, when they enter our respiratory tract and they change their shape, they become rod shaped, and the one end of this bacteria become tapering, and their tapering in contain an adherent molecule. This adherent molecule adheres with our respiratory epithelial cell, and this Mycoplasma pneumonia they produce hydrogen peroxide, and this hydrogen peroxide is a very toxic substance for our respiratory epithelial cell, and our respiratory epithelial cell go to the process of necrosis. And also the important thing is that due to presence of this bacteria, this Mycoplasma pneumonia on the surface of our respiratory epithelium, the ciliary movement is impaired. We know that mucous membrane of our respiratory tract produce mucus, and mucus along with necrotic cell or debris cell and other foreign substance, they are called sputum, and this sputum should be removed from our respiratory tract, and this is done by the ciliary movement. But due to attack of this bacteria, ciliary movement is impaired, so there is production of sputum, but the sputum, the removal of the sputum is not possible due to attack of this bacteria. And this accumulation of sputum within the respiratory tract give a favorable condition for the growth of this microorganism. Also this bacteria, this Mycoplasma pneumonia, they attack our larynx, they attack our pharynx, and they attack our tonsil, and the inflammation of the larynx, pharynx and tonsil is called sore throat. Our immune system makes antibody against this bacteria, but this antibody is auto-antibody because they also attack our RBC cell, they attack our central nervous system, they attack our lung, and also they attack our hepatocyte. Now, not only Mycoplasma pneumonia produce atypical pneumonia, but also other bacteria and virus also produce atypical pneumonia. We know that pneumonia means inflammation of the lung, but atypical pneumonia, what does it mean? Here the word atypical. Atypical means in the diagnostic laboratory we do not able to separate this pathogen from our infected cell. That's why it is called atypical pneumonia. And also other bacteria and virus, this bacteria Legionella pneumophila, this Legionella pneumophila produce Legionnaires disease, and Legionnaires disease is the one type of atypical pneumonia. Chlamydia pneumonia also produce atypical pneumonia. Chlamydia psittaci, this bacteria produce a disease that is called psittacosis, and this psittacosis is one type of atypical pneumonia. Coxiella burnetii, and they produce Q fever, and one of the important clinical feature of the Q fever is atypical pneumonia, and other is hepatitis. Influenza virus and adenovirus also produce atypical pneumonia. And another mycoplasma, that is called Mycoplasma hominis. This Mycoplasma hominis produce a disease that is called pelvic inflammatory disease. Treatment: we should give the patient antibiotic like erythromycin, like tetracycline, azithromycin, and also levofloxacin, fluoroquinolone. So this is all about the mycoplasma. Thank you.